Experience is not what happens to you. It's what you do with what happens to you. The other day we did a piece on ADD and Relay and all that, and I, you know, in terms of, you know, what our solutions are to what happens in our world, and you know, drugs, medication is enormously useful, especially, I mean, in all aspects of our world, obviously, but especially in dealing with issues of anxiety, dealing with pain, obviously. There's a lot of use for this, and there's obviously a lot of use with medications in terms of overcoming addictive illness, whether it's a substance abuse issue or a chemical dependency issue or a process addiction. These medications can be enormously effective in terms of helping people deal with these things. And the question is, in terms of, you know, the criteria for determining whether somebody has a problem with a substance, a drug or alcohol or something it used to sort of is harm, what harm it causes. And obviously the harm it causes me may be different than the harm it causes you, and we may both be very similar. Somebody who obviously, you know, takes pain medication, needs pain medication, takes it, for somebody else taking that medication can create a whole, you know, a panacea of issues. I don't, you know, having abused pain medication 25 years ago, I don't take it for anything. I take a lot of Aleve, I take a lot of Tylenol, but I take no narcotics because I know the harm in taking those medications would far outweigh the benefit. I have nothing against substances. I don't have anything against cannabis. I don't think it should be legal because there are too many people who, that's a really annoying sound that thing makes. I'm not against, you know, cannabis. I mean, but as a substance, I think, but in terms of legalizing it, the harm it would do to a significant portion of the population, you know, doesn't outweigh the benefits of legalization. Whatever those benefits are, and there are benefits. There's tax benefits. There's probably benefits in terms of you know, some of the folks that get busted for that and get and their lives become you know, changed and diminished because of that arrest or that record. So this is the criteria. What is the harm? And I think in terms of you know, as we were talking about before with the ADD stuff, these things could be enormously effective used the right way and used with good judgment. And that, I guess, comes to it. Like, is our judgment as good as it can be with respect to these things? Because somebody like me and the millions of people who have had a substance use disorder understand the power and the repercussions of bad decisions when it comes to you know, behavior or ingesting chemicals or alcohol as a solution for many of us. And before we go down that road, we really need to know that we are doing it in the most judicious and prudent and necessary way, because if we don't, and we do it you know, haphazardly, randomly, and with great prevalence, we are gonna pay an enormous cost for that.